So in this particular update at the ASH 2023 meeting, we reported the 200 milligram cohort in which 117 patients were dosed at linvoseltamab at 200 milligrams. The patients enrolled in the study were heavily pretreated with a median of 5 prior lines of therapy. 80% of patients were triple-class refractory, 39% of patients had high-risk cytogenetics, and over a quarter of the patients were over the age of 75. And just to recap the dosing schedule of linvoseltamab, patients received initial step-up dosing with 2 small doses of 5 milligrams and 25 milligrams dosed 1 week apart, with only a 24-hour hospitalization for CRS monitoring after the step-up dosing period. Subsequently, patients received linvoseltamab 200 milligrams weekly on a 28-day cycle for cycles 1 through 3, which was then de-escalated to every other week for cycles 4 and 5, and then further de-escalated in a response-adapted approach to 200 milligrams if a patient attained a very good partial response or better. So with this updated data cut with a median follow-up of 8.1 months, the overall response rate as adjudicated by the independent review committee was 69%, with the majority of patients attaining a very good partial response or better at 59%. And with also longer follow-up, we're getting longer mature data on time to event endpoints. And so the estimated 9-month duration response was 87%, and the estimated 9-month progression-free survival was 73%. So we're noticing that responses are deepening and they appear to be durable over time. In terms of safety, there are no new safety signals identified with the longer follow-up with linvoseltamab. Overall, the incidence of cytokine release syndrome, which typically occurs during the step-up dosing period, was relatively low, 46%, majority being grade 1 in severity. In terms of other adverse events of special interest, the overall incidence of grade 3 or higher infections was 37% in the 200 milligram cohort. So in summary, we're very encouraged with this longer follow-up with linvoseltamab at the 200 milligram dosing cohort. I think the key aspects of this particular BCMA bispecific include the relatively easier step-up dosing schedule with only a 24-hour hospitalization after the initial first 2 step-up doses, the rapid de-escalation, the frequency of dosing, which can de-escalate to every 4 weeks if attaining a very good partial response or better, and the relatively low rates of cytokine release syndrome. And so there's additional studies looking at linvoseltamab in other areas of multiple myeloma, including combinations with the LINKER-MM1 study, and early relapsed refractory multiple myeloma in the LINKER-MM3 study, and even newly diagnosed patients in the LINKER-MM4 study.